Today, Group 1 from PDB Health Communication will be explaining about traditional Chinese medicine, also known as TCM, for our video project. Next. Our members include G, Aisha Saraya, me, Sabrina, Li Poyan, and Noor Aziza. Next. So, introduction to our topic, which is traditional Chinese medicine, where it is practiced for at least 200 years in China. This includes herbal medicine, acupuncture, moxibustion, Chinese therapeutical massage, also known as Tai Na, food therapy, and physical exercise. It is mainly based on qi, which is the body's vital energy that flows through meridians or channels of the body and keeps the person spiritually, emotionally, mentally, and physically healthy. So basically, a good flow of qi means that the person is in harmony and has balance in their body. Next. So to continue the introduction, there are two fundamental theories regarding traditional Chinese medicine. The first one is yin and yang, where it is believed that the universe is composed of two opposites, which is the yin and yang. They are interdependent and can influence each other. Their equilibrium ensures the harmony in the body. And the next theory is called the five elements theory, which is also known as Wuxing, which is where the human body and herbs are considered as the five elements: wood, earth, water, metal, and fire. Next.
Moving on to advantages of traditional medicine, it decreases pain and inflammation. Pain and inflammation can result from a variety of conditions, including fibromyalgia, osteoarthritis, and migraines. Traditional Chinese medicine practitioners usually recommended acupuncture and herbal medicine when dealing with pain and inflammation. Next. It also reduces the body stress response. Traditional Chinese medicine is a holistic approach to medicine and can treat both the body and the mind. One of the benefits of treatments like Tai Chi.
So next I'll be talking about chrysanthemum. Chrysanthemum is the famous queen of the East, flower grown mainly in China and Japan. The most outstanding health benefits of chrysanthemum tea are easing stress and anxiety, improving cardiovascular health, protect against oxidative damage, inhibit inflammation, support healthy immune function, improve eye health, and lower risk of osteoporosis. In traditional Chinese medicine, chrysanthemum is a cold herb which helps dispel pathogenic heat, helps the liver, improves eyesight, and aids detoxification. It has been also known that chrysanthemum morphylium has many antioxidative resisting fatty, improving the function of the cardiovascular system and lowering the levels of serum lipid. It's closely related to the composition and content of phenolic compounds and apigen 7-0-glucosidine, one of the most active phenolic compounds in chrysanthemum flowers. They can also act as antibiotic agent against a variety of pathogens. It is reported that the extract of a fresh plant can be applied to the skin infections directly. For ginger, known as Zingiber officinalis, has been used as a spice and medicine for over 200 years in traditional Chinese medicine. It is an important plant with several medicinal and nutritional values used in Asian and Chinese traditional medicine. Ginger and its general compounds such as iron, magnesium, calcium, vitamin C, flavonoids, and phenolic compounds such as gingerdiol, gingerol, gingerdione, and shogaols. This has long been used as a herbal medicine to treat various symptoms, including vomiting, pain, cold symptoms, and it has been shown to have anti-inflammatory, anti-apoptic, anti-tumor, antipyretic, antiplatelet, antitumorigenic, and so on. It has been widely used for arthritis, cramps, sprains, sore throats, muscular ache, indigestion, hypertension, dementia, fever, and even infectious diseases. Fresh ginger has been used for the treatment of nausea, cold-induced disease, colic, asthma, cough, heart palpitations, swellings, dyspepsia, loss of appetite, and also rheumatism. The properties associated with ginger are anti-inflammatory, anti-thrombic, cholesterol lowering, blood pressure lowering, antimicrobial, antioxidant, anti-tumor, and also hypoglycemic.
Okay, so next we're gonna talk about the disadvantages of traditional Chinese medicine. Next slide. First of all, taking traditional Chinese medicine and other medicine at the same time may cause complications to arise. Mixing these two types of medicine could make the other medicine less effective and could also trigger unexpected side effects. Other than that, there's a possibility of a harmful interaction between the herbal medicine and other foods, beverages, and dietary supplements that the patient consumes. For example, milk is not recommended to consume when taking the medicine because it is believed to have a damp nature, yin, which is contrasting to the medicine that aim to supply warmth, yang, in their body. However, this is not applicable in all cases because it depends on whether the patient have cold or heat syndromes and whether they have too much yang or too much yin, or vice versa. Chinese traditional medicine consumer may also experience some side effects. A lot of times, herbal medication can mistakenly be perceived as safe because they are natural products, but they might also produce negative reactions such as allergic reaction, asthma, headache, vomiting, and so on. Next slide. Next. Moreover, not all herbal medicines are regulated. Remedies specially prepared by individuals do not need a license. Quality of the product manufactured may not be in line with the standard requirements of the government in terms of health and safety, since they are not required to be monitored, so there is no guarantee on the dosage and the safety of the medicine. The evidence for the effectiveness of herbal medicine is generally very limited too. Although some people find them helpful, in most cases they are based on traditional beliefs rather than scientific research. Until now, there are no firm conclusions made from their effectiveness by scientists, so it still has a chance that the medicine may not work as expected.
And also, traditional Chinese medicine may interfere with surgery. Some herbal medicines may interfere with anesthesia and other medications used before, during, or after surgery. Manufacturing defects can also happen in TCM, like, for example, incorrectly substituting one herb for another. Studies shows that most of the traditional Chinese medication compromises an amount of lead, cadmium, arsenic, mercury, steroids, pesticides, antibiotics, and other dangerous metals, or even psychoactive pills, even though the label did not declare it. These chemicals can cause kidney or liver damage. And also, not all ingredients are listed or even legal. Some herbal medicines contain traces of endangered and trade-restricted animals, such as Asiatic black bear and the Saiga antelope. And for the final disadvantages, the medicine harbored ingredients not mentioned on the packaging. For example, a product labeled 100% Saiga antelope contained considerable quantities of goats and sheep DNA. Okay, moving on for the health problem. The study titled Analysis and Control of Adverse Drug Reactions, ADRs, due to Chinese herbal medicine TCM injections in children, aims to analyze pediatric ADRs due to TCM injections and their associated factors and the basis for them. Consider drug use and safety clinical measures. The pediatric population is therefore at significant risk from TCM injections that can lead to these ADRs, such as fatal anaphylaxis and anaphylaxis shock.
In most regions where TCM is practiced, including China and other nations like Nigeria, Tanzania, and South Africa, have reported ADRs in children, although there are also many who claim that these medications have cured them. However, if ADR are so severe that they can cause the death of a young person, shouldn't these pseudoscience be researched thoroughly by independent researchers before claiming it as a panacea?
World Health Organization and European Union issued the guidelines define the basic criteria for the evaluation of equality, safety, and efficacy of herbal medicine with the goal of assisting national regulatory authorities, scientific organizations, and manufacturers in assessing documentation, submission, and dossiers in respect of such products. Legislative controls in respect of medicinal plants have not evolved around a structured control model. There are also different ways in which countries define medicinal plants or herbs or products derived from them.
In this regard, WHO has issued guidelines for the assessment of herbal medicines. As you can see here, the WHO guidelines include the quality control methods for medicinal plant materials, guidelines for safety monitoring of herbal medicines in pharmacovigilance method systems, guidelines in the regulation of herbal medicines in Southeast Asia region, guidelines for methodologies on research and evaluation on traditional medicine, National Policy on Traditional Medicine and Regulation of Herbal Medicines report of a WHO Global Survey, guidelines on good agricultural and collection practices for medicinal plants. These guidelines define the basic criteria for the evaluation of quality, safety, and efficacy of herbal medicines with the goal of assisting national regulatory authorities, scientific organizations, and manufacturers in assessing documentation, submissions, and dossiers in respect of such products. Following that, the European Pharmacopoeia was created in 1964, with its efforts have resulted in the creation of 83 monographs on herbal drugs that are used either in their natural state, after desiccation or concentration, or for the isolation of natural active ingredients. The Association of the European Self-Medication Industry has carried out a study for the European Commission on herbal medicinal products in the European Union itself.
So to conclude, traditional Chinese medicine TCM have shown the advantages, where it has shown that using acupuncture and herbal medicine can decrease pain and inflammation. It is also a holistic approach used to reduce body stress response. However, there are disadvantages as well, where it can affect the use of other medicines taken, making them less effective or have side effects. There's also a possible reaction between herbal medicines and other consumptions taken. Not all herbal medicines are licensed or have been scientifically researched, so it is not guaranteed to work successfully. Next. It also may contain toxic chemicals as well. So the health issue discussed previously mentions how TCM injections vaccinated into children had adverse drug reactions, ADRs, have caused deadly anaphylaxis and anaphylactic shock. Although some people in some countries claim that TCM have cured them, it is still considered as fatal since it results in the death of children because of ADRs. Therefore, it raises still the question, shouldn't researchers study about ADRs and TCM before it can be considered as a solution for all illnesses? Therefore, there is the solutions to prevent other issues as well, which is raised by the World Health Organization and the European Union, which they issue guidelines for basic criteria to evaluate the quality, safety, and efficiency of herbal medicine by assessing the official documentations and submissions of products with the help of authorities and scientific organizations. Next. So these are all our references used in the video for our video project. So that is all for our video. Thank you for watching, and we hope those watching have gained more insight regarding traditional Chinese medicine. Thank you.